Welcome to Britain Air News. I'm your host, Aaliyah Tampa.
And I'm your co-host, Shabby Lambright.
Today, we will be talking about the pulmonary system!
We have different scientists and different interviews that we're going to be conducting to get y'all some more information about the pulmonary system.
Hello everyone, here with Dr. Hemi, respiratory therapist and respiratory analyzer. So tell me, what is the pleura exactly?
Alright, so the pleura is actually the outer membrane. Well, it has 3 layers, and it's the membrane of the lungs.
What are the layers, if I
Alright.
may ask?
No problem. We have the visceral layer, which is the inner layer, and it adheres to the lungs. The parietal layer, which is the outer layer, and it lines the thoracic wall and the diaphragm. And last we have the pleural cavity, which is the in between those layers, and it is filled with a fluid.
Good to know. Thank you for that information. Back to the ladies in the studio.
Wow, that was great information from Dr. Hemi. Thank you. All right, and now we're going to check in with our diagram specialist. Take it away, Maria.
Hello. Today I'm going to be talking about the passageway of the pulmonary system, but first, me and my buddy here just wanted to say happy holidays. Let's get serious. Do you like inhaling? Do you like exhaling? Well, let me tell you a little about it. Inhaling is when you go like this. Exhaling is when you go like this. Okay, got that out of the way. Now, let's talk about the more serious stuff here. First thing first, depends on if you breathe through your nasal cavity or your oral cavity. The passageway isn't much different, just one has a little bit further to travel, but not much. Most likely, you're inhaling through your nose, exhaling through your mouth. Let's move a little down, shall we? After you breathe through your nasal or oral cavity, depending on what type of person you are, we're gonna move down to the pharynx, which is AKA your throat. It's just a fancier name for it. This little structure right here is the epiglottis. It basically keeps you from aspirating your food, drink, whatever. It's pretty great. Comes in play in the digestive system as well. And then you're gonna move down to your trachea, and that connects to the bronchial tubes, which then connects to your lungs. Now, the lungs are a very important structure of the pulmonary system because without it, we wouldn't have a pulmonary system. So the right lung is a little different than the left lung because it does have 3 lobes instead of 2. The reason that the left lung has 2 lobes is because the heart is more towards the left side, so the left lung is a little more compromised. So then in the lungs you have the bronchioles, which are like just little tubes that the air goes to get like actually into the lungs. And then these bronchioles have alveoli, which exchange oxygen and carbon dioxide. And cilia, you probably heard that word before. It's hair-like structures in the lungs and a little bit up here to prevent dirt and mucus going from in the lungs, because that can cause a whole bunch of different problems. If you've heard apnea in a sentence, it's probably because you've heard it with sleep apnea. And basically what sleep apnea is, it's when you're not breathing when you're sleeping, and that can cause hypoxia. Hypoxia is when you're not breathing properly, your tissues aren't getting enough oxygen, so it just causes them to deteriorate and get bad, causing you to not move properly, stuff like that. It causes you to get weak. If you're wondering what helps your lungs move, it's basically called the diaphragm. The diaphragm is a strong muscle that pulls your lungs down when you inhale, and when you exhale, it goes back to place.
All right, thank you, Maria. That was some great information. Now we're gonna go and listen to another doctor and talk about some diseases that are caused by some things like smoking, vaping, and what the effects are.
All right, I'm Dr. Harmeritz, and I'm here with my patient, She was born with asthma, and now she's developed a case of COPD, chronic obstructive pulmonary disease. So the reasoning for that is because she started smoking cigarettes at age 10, and now she likes to Juul daily. She goes probably through 5 pods per day. Terrible. So her symptoms for asthma, shortness of breath, which is basically just difficulty breathing, wheezing, chest pains, yeah, as you can tell. Her treatment that I put her on is inhalers. She doesn't use it. So yeah, asthma is basically just a condition in which a person's airways become inflamed, making it difficult to breathe. Moving on to COPD, just another condition that blocks airflow, making it difficult to breathe. So overall, her ventilation, which is another word for breathing, is very bad now and makes her asthma act up.
And that's on City Girls, period.
All right, thank you, Dr. Hammeritz. That was some great information. So that is all the time that we have today, and thank you for joining Britain Air News.